Welcome to TrulyFit.
Welcome to the TrulyFit Podcast, where we interview experts in fitness and health to expand our wisdom and wealth. I'm your host, Steve Washuta, co-founder of TrulyFit and author of Fitness Business 101. If anyone's new to this podcast, I typically do two different types of episodes. I do these solo episodes where I'm talking about something that is trending in the fitness or health or wellness space that I feel like I want to give my 2 cents on and comment on. And then I also do interview episodes where I have on a guest who's an expert in the fitness or health or even medical space come on to talk about whatever it is that they are an expert in. We try to really zoom in on one topic. It's almost like a thesis paper, if you will, in those interview episodes. I don't like them being vague. I don't want somebody to come on and talk about, how to get in shape. No, I want somebody to give me very specific, nuanced conversations. So we're basically answering a question, solving a question, right? What is X? How to do Y? And those are the conversations. And I like to keep them around 45 minutes or so. These episodes are solos with just me, again, commenting on something in the health and wellness and medical, sometimes even sports space that crosses over, that is trending, that I want to give my 2 cents on. And they're shorter, 5 to 15 minutes. And today I'm going to comment on the very trending topic of Max Crosby, who is a defensive end for the Las Vegas Raiders. Maybe, who knows, who kind of still is, and was being traded to the Baltimore Ravens, and he, quote unquote, failed his physical exam, and therefore is no longer in that trade package. And I'm not going to speculate on the rumors. There's a lot of rumors going around that Baltimore sort of regretted all they gave up for Max Crosby in the first place. And when they found out they can get Trey Hendrickson, when they found out, other deals that were going around in the league, it just didn't make sense for them to give up as much as they did. And they backed out of that trade. However, let's just stick with what we know, and we can speculate afterwards. That'll be fun. So from a physical exam perspective, so Max Crosby in January had a meniscus surgery, a repair surgery. Now, I'm going to put a picture up here on the screen. If you're listening, you don't get to see this, but basically there are two different pieces of menisci, so to speak, right? You have the medial and you have the lateral. And what is the meniscus exactly? It's a piece of cartilage. It sort of cushions and stabilizes your knee joint. It's like other cartilage. It's a shock absorber. It protects bones and wear and tear over time. And I think it's important. We will discuss this a little bit later on. I want to sort of, put a pin in this, the difference between the medial and the lateral, and why that could matter in this case when Max was being looked at by his physicians. But, both are shaped like C's. Again, they provide cushion, and they're, it's between your tibia and your femur, your shin bone and your thigh bone. And there's different kinds of tears, right? There's wear and tear over time. Somebody like me who's worked with seniors most of my life, you're going to see that these seniors, I mean, I don't know, probably almost, over 1 in 3 people over the age of 70 have some sort of, meniscus tear from just wear and tear over time. Is it affecting them? Maybe not, but it does sneak up on you. And then there's more of like an acute tear, and you see those acute tears, let's say in the lateral meniscus, more with like an ACL injury, whereas in the meniscal tears that are associated with the medial, a lot of times more that ACL injury, you could have ACL injuries that are chronic. And I think that's important here to say, because not always, but when upon viewing him, because he had a medial fix, is that the doctors might have saw that there was some ACL, again, not tears, but there could have been some, ACL chronic issues and injury that they wasn't reported to them until they were able to both do a physical examination and palpate, put their hands on him, in addition to seeing the imaging. And I guess really where I want to start here is everybody thinks that this is nonsense. And let's just slow down a little bit, and I'll give you the reasons why this maybe could not be nonsense. First of all, most people do not need meniscus surgery. Okay. Surgeons, they're hammers and everything's a nail to them, right? They think there's only one way to fix things, and they only know how to fix things one way because that's what they were taught. That's what they know to do, right? They're not gods. They're not be all end all. Most of the studies show that even at the 5-year mark, when you look at people who decided, of the same level of tear of a meniscus, whether it's lateral or medial, who decided not to get surgery, are in the same position, both in, pain and range of motion, whether they got surgery or didn't get surgery. There's a study done in the, I'll try to put it up here quickly, in the New England Journal of Medicine, where basically it was an arthroscopic partial, it's called a meniscectomy versus basically just a sham. So instead of actually doing the arthroscopic surgery, they took some people in and they poked holes in them, but they didn't do the surgery itself. And, both patients showed the same level of recovery, right? Whether they actually did the surgery or whether they just, did the sham surgery. So in most instances, actually, it's almost not conducive because long-term, I think surgery is not surgery is not surgery. In a meniscus surgery, you're not actually fixing something, right? So if I have a fractured femur and I need to put a plate in it, right? I am now strengthening that bone, so to speak, right? Maybe I have screws or a rod in it or something to that extent. In an ACL surgery, there's a tear and you're fixing it. In, let's say, the tightrope surgeries that Tua got before the big Alabama game, you're putting something through the ankle to make it more stable. In a meniscus surgery, all you're doing is taking some meniscus away, right? So now you have less of it. You're not fixing anything. You just have less of it, and the recovery process is longer. Although people wouldn't think that, but it's actually just shorter to go straight to PT rather than do it. Now, I'm not saying Crosby didn't do all that, right? Maybe he did all the physical therapy. Maybe he did PRP. Maybe he did shockwave therapy. Maybe he tried everything and then just couldn't find any other relief for pain and said, this is the worst case scenario, but this is what I have to do. I have to get the surgery. But in most cases, you don't need surgery. And there's always issues with surgery. That's just how it works, right? There's always a chance of having complications from surgery. So when these physicians put their hands on him, and that's something I guess, let's go to this part. So now you have a clinical evaluation of how a surgery went after however many weeks, right? The average surgery, let's say, is 6 weeks, and so on and so forth. Right? Maybe another 6 weeks out, or maybe you go 12 weeks out from that point. And then the initial clinical diagnosis sometimes, or clinical review is just imaging. So they might look at MRI and say, hey, look, the menisci is healed. We can see there's no scar tissue forming, and everything looks good. But that's not the functional test, right? Until you can palpate and get your hands on, until you can see the athlete, in this case, the asset that they're purchasing, the functional test is really what shows you what's going on. So, Max is only, 8, 9, 10, 12 weeks out at the most from the surgery. So, in this phase, you shouldn't be able to do much except be weight bearing, but maybe the doctors saw where he was in his recovery, and although his doctor's saying, yeah, he's on par, he's going to be fine, he's doing well, maybe they disagreed with that. Maybe they said, you know what, at this stage, we think you should be doing X, Y, and Z, and you're not. Your range of motion should be this number, and it's not. Your weight bearing should be at this percentage, and it's not. And we're nervous, right? We're paying top dollar for you, and you're not showing all the signs that you are on an expedited recovery here. So we're going to back out. That could have easily happened. I don't know why people think that's so far-fetched, because it doesn't happen often. Well, it doesn't happen often, maybe because people think they're getting a deal. But if the Ravens were paying the house and more for this player, and they didn't feel like they were getting a steal, then they're going to want to make sure that this athlete is 100% okay. And also, who knows what the Raiders physicians told them, right? And who knows, they could have just sent them over the paperwork, right? And not told them what they got in the functional tests when their hands were palpating on him. What was the range of motion? Was it still sort of making noises? Was it catching anyway? Is it still catching? Does that mean he's going to have to go in to get another surgery, perhaps, which delays him more? These things happen. Meniscus, again, you're not fixing anything. You're just taking some meniscus away, which isn't great, right? It increases your chances for to be arthritic in the joint, to have osteoarthritis. So I think we shouldn't just pretend, although all signs are pointing to the Ravens might have just said, well, now that we found out we can get Hendrickson for cheaper and we can do other things, let's just back out of this. The Cowboys doctor, who also viewed him and is very well established in the NFL community, he said the same thing. And the Cowboys, who would be going after somebody like Max Crosby, could have gone after someone like Max Crosby or not. Even in this case, even now that Max Crosby fell through and the Cowboys could still go after him and make moves, it seems like they're not doing it. So maybe their doctor saw something we don't know. Again, because it was the medial rather than the lateral. Could it just be some long-term sort of a chronic ACL issue that's also in there that wasn't talked about? Could the surgery have not gone well? Could he just not be rehabbing at the juncture that they expect him to be at this given point? There are a lot of things that go on here, but I think when people think surgery, they think fixes. Not a fix. There's no such thing as fixing it. We don't have that science, that technology yet to fix a meniscus. You're just taking some of it away so that it's either not catching in certain areas or so it's causing less pain, but you're not necessarily fixing it. The best way to fix it is to strengthen the muscles in and around that area and go through rehab. Again, there's evidence of this, right? Your rehab is better than doing this. Now, if it was an acute tear and he had no other choice and it was very bad, I trust that the physicians know more than me sitting here as an armchair, personal trainer who just helps people post rehab. But in that same juncture, to pretend there's not complications with surgery, to pretend that athletes who go through these surgeries don't recover like they should, it happens. So let's not pretend to know that the Ravens were lying, so to speak, and just trying to get out of this deal. There could have been complications with the meniscus. And for anybody who doesn't know anything about the knee and you learned something today, that's great. Feel free to shoot me a message if you disagree. I think there's a link that you can actually text me directly from Spotify. Otherwise, you can leave a message at social@TrulyFit.app. Feel free to shoot me an email. And thanks for listening, guys.